Hello, my name is Justin Sanford, and the title of my study is The Crisis of Mental Well-Being During the COVID-19 Pandemic. COVID-19 has now claimed the lives of over 580,000 Americans, but fighting a pathogen is not our only national crisis. Many have grown weary of hearing phrases like social distance and mask up, but the issue is deeper than the tiring of repeated phrases. Following such health protocols counteract the very things we need to do in order to maintain our mental well-being. Isolation and limited human contact makes us more vulnerable to developing mental health conditions. And research confirms this. The number of adult Americans experiencing psychological distress as a result of the pandemic are higher than they were in the wake of other national traumas like September 11th. Furthermore, considering research from past natural disasters, we can expect almost 10% of people will develop severe psychological problems like mood disorders or PTSD. But there's also good news. Research has revealed that easily accessible interventions like self-applied therapies can enhance mental well-being. I wanted to quantify both the scope of the mental health crisis and the best mental health solutions. Therefore, I asked the following questions. How much has the mental health of Americans been affected by the pandemic, and what type of supports have people sought out to aid their mental health during the pandemic? With this exploratory cross-sectional study, 391 people were surveyed through digital outreach. Data was collected by means of a self-administered survey, and descriptive statistics were used to analyze the data. We can see from Figure 1 that over half of the participants perceived the pandemic to have a significant impact on their mental health. This is supported by data from the survey that revealed even though many were experiencing mental health symptoms before the pandemic, over half of the respondents were experiencing new mental health symptoms as a result of the pandemic. Figure 2 gives us an idea of more formal supports people have utilized for mental health needs during the pandemic. It reveals that substances and medications are being utilized at a similar rate as attending therapy, but easily accessible and formal mental health supports, like hotlines and therapy groups, are not being utilized. Figure 3 shows that self-applied supports such as exercise, keeping a daily routine, and maintaining a consistent sleep pattern are perceived as effective ways to cope with pandemic stress. These findings add more support to the existing research that reveals this pandemic is having a profound effect on people's mental health. Here's the implications for practice, policy, and research. Concerning practice, social agencies should be aware that the need for substance use and interventions will increase, along with the obvious need for mental health interventions. Social agencies should work to build awareness for low-cost, easily accessible services such as teletherapy, group therapy, and provide awareness and education of non-medicinal mental health supports via social media platforms. Concerning policy, social workers should advocate for state and federal policies that would require insurance carriers to cover therapy and other mental health interventions. Though the need for mental health interventions will increase, access to therapy services will still be limited for many due to high insurance coverage and out-of-pocket costs. Concerning research should continue concerning the most effective supports for mental health complications resulting from the pandemic to help social workers identify which type of interventions would be best to advocate for being covered by private insurance. So this study painted a picture of the scope of the mental health crisis that will come in the wake of the pandemic. But it also provided a hopeful look at simple, positive, and cost-effective ways people can manage mental health symptoms. At this time, I welcome any questions or comments you may have.